Today, I have a bunch of the most common myths about children's bone fractures that I hear in my OPD, and I'm going to pick them up one by one and tell you the truth behind each one. If my child can still move the arm or leg, it cannot be fracture. This is one of the most dangerous beliefs I see in parents because it makes them delay coming to the hospital. And let me be completely honest, telling the difference between a fracture and a bad sprain or bruise is genuinely hard. Even experienced doctors need an X-ray to confirm. But here are some signs that strongly suggest a fracture, and you should not ignore. These include swelling that appears rapidly, especially directly over a bone, a limb that looks visibly deformed or bent at an angle that does not look right, and pain that sharpens when you press the area gently, even with very light touch. But the most important signal of all is your child's behavior. If your child is completely refusing to use that limb and not putting weight on a leg, not moving an arm, holding it close to the body, then please trust that instinct. Children do not protect a limb unless something is seriously wrong. So even if your child can move the arm a little, that does not rule out a fracture. Treat it as a fracture until a doctor confirms otherwise with an X-ray. When a child falls and hurts a limb, massaging the area with mustard oil or applying a tight cloth binding is the right first response. This is one of the most common reasons fractures get worse before the child even reaches the hospital. The first and most important rule is to not massage the area. Yes, please do not do it. I see this reflex constantly in my OPD where parents instinctively rub the swelling because that is what we have always done in our households for any injury, but with a fracture, that massage can shift a stable break and cause more damage. So hold the limb still in whatever position it is naturally resting in and do not try to straighten it. Use anything rigid as a makeshift splint. It can be a rolled newspaper, a magazine, or a flat stick, and tie it loosely with a cloth. Apply ice wrap in a cloth to reduce swelling and never ice directly on the skin. Keep your child as calm as you can and get to a hospital as quickly as possible. One emergency sign that every parent must know is if a bone is visible through the skin, cover it with a clean cloth and go to a hospital immediately. So this myth is definitely busted. Every fracture in a child needs surgery and a long hospital admission. This is a fear I see in almost every parent when they hear the word fracture. But most children's fractures do not need surgery, and this truth surprises many parents. Everyone should know that children's bones are fundamentally different from adult bones, and they are more flexible and pliable. So they often break in a way that stays naturally aligned. When that happens, a plaster or fiberglass cast is all that is needed. The cast holds the bone in position while your child's body heals it on its own. Surgery is reserved only for specific situations when the bone has shifted significantly out of the alignment, or when the fracture involves the growth plate in a complex way, and these cases are the minority, not the majority. So eventually, most children leave the emergency room with a cast and a follow-up appointment and not a surgery booking. Please know this because it should take a significant weight off your mind the next time you're sitting outside an X-ray room. Hence, myth busted. Children heal faster than adults from fractures. Very interesting. And this is not totally a myth because it is something parents say all the time. And for once, they're absolutely right. But this is because children's bones are actively growing, which means they have a much richer blood supply and far more active bone-forming cells than adult bones. This makes them heal significantly faster. A forearm fracture in a 6-year-old might be solid in 4 weeks, but the exact same fracture in an adult takes 8 to 12 weeks, and generally the younger the child, the faster the healing. Children also have a natural ability called remodeling. That means their growing bones can gradually self-correct small imperfections in alignment over time, which is something adult bones simply cannot do. And this is important. But the faster healing does not mean your child can go straight back to full activity the day the cast comes off. There are a few additional weeks where the bone is healed but not yet at full strength. So please avoid rough play and contact sports during that window, even when your child is begging to go back outside. So this myth is confirmed but with a condition. Once the cast comes off and the child seems fine, there is nothing more to worry about. The fracture is fully done. See, as I previously said, it is the myth that causes the most missed long-term problems. Children's bones have something called growth plates that are soft, cartilaginous areas near the ends of long bones, where the bone actively grows in length. If a fracture runs through or near one of these growth plates, it needs careful monitoring even after the cast is off, because these areas are more vulnerable than the rest of the bone. Now, in most cases, and I genuinely want to reassure parents here, a growth plate fracture heals completely with no long-term impact at all. But in a small percentage of children, it can affect how the bone grows later, leading to a slight difference in length or angulation over time. The risk is low, but it is real, and that is exactly why any fracture near a joint or near the end of a long bone needs an orthopedic follow-up even after the cast is removed, and your child seems perfectly fine. Please do not skip that appointment just because your child is back to running around. So, myth busted. So these were the 5 biggest myths I hear about children's fractures in my clinic every week. If you don't want to fall for one such myth, then find a trusted pediatrician or pediatric orthopedic specialist on Practo. One consultation, one X-ray, and you will know exactly what your child needs. If this video helped you understand something nobody in your family was able to explain clearly, please share it with another parent who needs it more. Also, subscribe to Practo for Kids and hit the bell icon.